So I've just finished my talk at the Red2Green event, which has been a fantastic idea, a fantastic day. And the idea for me around Red2Green is really understanding about some of the delays which happen to our patients in our hospitals and on our acute and non-acute wards as well. Because understanding the delays and the reasons why patients are in hospital enables us to focus our attention on trying to reduce the amount of time that these patients spend in our hospitals. Because what we do know is that the longer the patients spend in hospital, the more that they can decompensate that.
Hi, I'm Richard Harding, General Manager at George Eliot Hospital, and I've been leading the Red2Green implementation at the Trust for the last 12 months or so now. For us, the most rewarding factor is seeing tangible changes to some of the patient metrics around length of stay and stranded patients, and on 2 wards in particular that have really adopted the philosophy and the mindset is seeing that change and that enriched patient experience and staff that have really bought into the principles. For me, if I was to offer any information or any advice to other trusts that are looking to implement this, is I would say that make sure you can't do this in isolation. You need a real team approach to delivering this.
Red2Green for us in the non-acute setting has been an absolutely amazing, fantastic journey. It is all about passion, it is about enthusiasm, it is about changing your way of thinking, changing culture. Just get up and get going, get everybody dressed, get everybody moving. Let's have some green days, let's add some value to people's lives. If you've only got 1,000 days left, that's 142 weekends. If I said to you, right, you've only got 142 weekends left to live your life, what would you do? You'd want to absolutely throw yourself into every weekend. And so this is the same for our residents. We are really flying the flag for them.
And I feel to make Red2Green a success in your area, you need a robust board round to start the day with clear EDDs, followed by a ward round with a summary huddle in the afternoon to make a success for patients. If you had 1,000 days left to live, how many of those would you want to spend in hospital? Please ensure that you escalate all your red delays in your Red2Green meeting to make patients go home as soon as they possibly can.
For me, Red2Green, the main thing is that it brings together a lot of the multidisciplinary team. So we have 2 rounds a day. We have a board round in the mornings, which is attended by both consultants on the ward with all of the junior doctors, nursing team and therapy staff, case managers, and a pharmacist as well. That means we start the day knowing what the plans for the patients are for the day and what we are trying to achieve for each of the patients. We can also highlight at that point anything from the day before that didn't get done that we need to chase to find out whether or not we can actually do that day.
So I'm a transformation project manager. I've worked with the patient flow team. The 3 key things I would say with regards to Red2Green is senior clinical engagement at the board round for successes, staff engagement, so ensure that all your staff are engaged in the Red2Green process, and ultimately that you are engaging with your patients on Red2Green and to end PJ paralysis.